good morning everyone. Today we're talking with Erica Loesel. She is a co-op here at Auburn Optical, and she's going to be talking to us about Parkinson's. So Erica, would you like to take it away?
Yeah, sure. Okay. Parkinson's disease is a neurodegenerative disorder that affects dopamine-producing neurons in the brain. Symptoms of this disease start gradually and then over time can build up and cause severe injuries. Parkinson's does not have one certain cause, but can be affected by specific gene mutations, exposure to certain toxins, and specific nerve cells breaking down. Symptoms of Parkinson's often include tremors and limb stiffness, gait and balance problems, slowness and a shuffling gait, and also softness of speech. There is no single test that can identify Parkinson's disease, but if you have a few of these symptoms, your doctor may refer you to a movement disorder specialist who will then confirm the diagnosis. Sadly, there is no cure for Parkinson's disease, but medication, exercise, and surgery are all very helpful. Medication includes a drug that mimics the effect of dopamine on the brain, known as levodopa, and there's also a surgery option known as deep brain stimulation, where a surgeon will insert a gel formula of the levodopa into the brain. Exercise includes dance, tai chi, Pilates, yoga, non-contact boxing, and flexibility training. Parkinson's disease cannot be prevented, but following a healthy diet and exercising on a regular basis are all very helpful. Parkinson's has many effects not only on our bodies, but can also cause many visual disturbances in our eyes as well. It can cause loss of retinal cells, like up here, which rely on dopamine to process and perceive color. And treatment for this includes dopamine medication, as I talked about earlier. You can also have difficulty opening the eyelids, known as apraxia, and you can use special tape or glasses with these wire loops, like up here. These are known as crutches, and they actually hold your eyelid open.
Oh, they actually hold the eyelid open. Wow.
Yeah. And then you can also have impaired movement in the eye, which is difficulty keeping the object in focus. And treatment for this includes prisms, which are these little odd-shaped things in here. These lenses help you to keep that object in focus. You also could have less frequent blinking, which causes dry eyes, irritation, and burning eyes. And treatment for this includes eye drops and ointments. And lastly, you can actually have involuntary eye closure, which is known as blepharospasms, and like these down here. Yep. And treatment for this actually includes Botox injections into your eye muscle.
Wow, that's quite a lot going on there, isn't there?
And then on this side of the poster, I have some images of people that were diagnosed with Parkinson's disease. Up at the top, we have George Bush, diagnosed at age 86. Robin Williams, diagnosed at age 63. Janet Reno, the first female Attorney General of the United States of America, diagnosed at age 65. Muhammad Ali, a very famous pro boxer, diagnosed at age 42. And also Johnny Cash, diagnosed at age 65. Then lastly, down here, we have somebody who's near and dear to my heart, and this is my grandfather, Arthur Loesel, who's diagnosed at age 72, and as you can tell by his little boxing gloves, we call him Rocky.
Dude, that's awesome.
Yeah. He practices the non-contact boxing, which are community events that patients of Parkinson's get involved in to help cope with the disease. And over here I have some examples that we also have some of these community events in our area for our local patients of Parkinson's.
Tell us a little bit about those community events.
So we have exercise and movement classes, and we also have support groups. And these are not only just for the patients, but also for the families of the patients, so they can kind of talk through it and learn how the disease is going to affect their family.
Oh, that is fantastic.
Yeah, it's really great for the patients.
And is this an overview here of Parkinson's disease?
Yep. This is kind of what the information that I went over.
That's so cool. And will that be on your blog then as well?
Yes,
where you
it will be on my
wonderful.
blog. Yep.
That is fantastic.
And then lastly, I have a few quick trivia questions to ask.
Oh, good. We could use some trivia. What do you got?
Number 1, Parkinson's disease is only seen in patients of older ages. Number 2, Parkinson's disease is a movement disorder. Number 3, what does the body's nervous system control? Number 4, severe headaches are a major symptom of Parkinson's disease. And lastly, number 5, how many stages of Parkinson's disease are there?
So are you going to help the people with the answers?
Well, if you want to find out, you can come on into Auburn Optical and find out and see how close you are.
Oh, that is fantastic. Yeah. All right, everybody, so if you get a chance, stop in this week, because Erica will be more than happy to talk to you about Parkinson's disease, and I want everyone to Look forward to future stuff. What's going to be next for you?
We have tsunamis.
You're going to be doing tsunamis. I love that. What a change.
Cool. Yeah.
Well, I appreciate you taking the time to go over Parkinson's with us, and really quite fascinated by your grandfather there. He looks really sharp with his boxing gloves on. Well, thank you, Erica, for sharing something so near and dear to your heart, and stay tuned.